Mental health crisis has impacted us all on some personal level. I've seen how it has impacted my peers and the people who I have grown up with, and people who are struggling with mental health crisis don't always get the help and support that they need. The driving force behind me pursuing a job in the mental health field is because I want to be that help. My name is Christine, and I am participating in CareCore's Psychiatric Social Health Technician training.
CareCore was launched in partnership with New York City Health and Hospitals to address the mental health workforce shortage in New York City, connecting people with lived experience into positions which can launch not just jobs, but careers.
Projections are currently saying that by 2030, we're going to have 350,000 vacancies within mental health care. We need to be able to deliver care to New Yorkers without exception. Trainees actually participate in classroom-based learning with Project Renewal, and then they come and work with us through simulation and debriefing to develop the skills they need to be psychiatric social health technicians. We lovingly refer to it as a simternship, and essentially we've created a 3-week training program where we recreate the psychiatric inpatient unit using simulated patient actors to really replicate the environment they're going to be working in.
To learn something on pen and paper, it's great, but when you actually get that hands-on experience, you feel a lot more confident when approaching real-life scenarios. We are all very passionate about entering the field, but most of us didn't have the experience or knowledge that we needed to be in the role of a psychiatric tech.
It's kind of the entry level within our nursing department. And they're really the eyes and ears of the unit. They're the ones that are spending the most amount of time with our patients. So they're the ones that our patients develop trust with.
So we went there.
When we think about the trainees who are coming to us through CareCore, they're bringing their lived experience, both from maybe their own personal experiences, but also their professional experiences. And so with that comes this capacity for empathy that is so crucial to being able to provide care to psychiatric patients within our hospital system. And I think that's probably the special sauce.
We got to share some of our own personal experiences and why a lot of us are so passionate about working in the field. Everybody's impacted by mental health. We've experienced that in our families, in our friendships, in our interpersonal relationships, and that is like their driving force. I think a lot of us, including myself, see ourselves starting off as a psychiatric social health technician and then moving up from there.
The psychiatric social health technician positions can lead to a really rewarding and impactful career for those who want to take on this career pathway.
Based on our first cohort, which was about a year ago now, we have 100% retention rate. And that's something we're really proud of, because what we know is that the first 6 months to 1 year, it's often when people leave their jobs. And here we have folks who are still thriving within that environment. The Project Renewal CareCore trainees who are joining us are some of the most inspired and motivated people I've ever worked with. And it's been a really special experience over the past cohorts that we've had.
This is really important work, and being a part of this growing field is truly a privilege. I find a tremendous amount of joy in being a part of somebody's therapeutic experience and watching them, grow, watching them step into their power and heal.